I'm letting you know how important it is to get checked out. Sometimes skinny people can have high cholesterol because of the kind of food they eat and because they inherited it from their family. Anyway, let's continue. So, how would your doctor diagnose this cholesterol? You're not going to be able to know if you have high cholesterol or not until they run some lab, your lipid panel, to check your cholesterol level. So that's why it's important for you to go to your doctor, and your doctor will order this lab. It's called lipid panel. So in this lipid panel, it has three elements. One is LDL, which is the bad cholesterol. So it is required that LDL has to be under 100. Good cholesterol is called H, it's supposed to be more than 40. So there's another one, which is the triglyceride. It's another bad fat in the body that could cause other health issues like pancreatitis. Triglyceride is required that it is under 150. And there is a total cholesterol, which is a combination of the other three I have mentioned. So the monitoring by American Heart Association. It is recommended by American Heart Association that anybody that is 20 years old and above should get their cholesterol check every 4 to 5 years or every 4 to 6 years. So if you're 20 years and above, you need to start monitoring your cholesterol level. And those that are over 40 should check their blood, their cholesterol every 2 to 3 years. And those that are older, or those that already have ongoing hyperlipidemia issues, should check it yearly. So at my place of work, we usually check it every 6 months. If your doctor runs your cholesterol level and find out that it's high, before you do the lab, it's required that you go without eating food, which is called fasting lab, so that they will be able to get the right number without the food you ate affecting the level. Because after you eat, it's just gonna, all the fat and everything is just gonna rush in your bloodstream. And when your blood is drawn at that point, it's gonna show some kind of false positive. So the best way to get your lab is to go without eating, so that your doctor will be able to, diagnose you well. What are the treatments? Most of you will be saying, oh, cholesterol, yes. Most of the medications are very cheap. You come to find out that most of these health issues is cheap to treat them. But people walk around ignorantly, or they don't care, or they don't know there's something there that could cause, lots of health issues. I mean, you hear people every day having heart attack, having stroke, It didn't happen, it didn't build up over time. Most of them took time to build up, like I mentioned earlier. So it is very important you go to your doctor to get these labs run and check your level and start treatment. And sometimes some people, lifestyle modification, lifestyle changes could help to reduce their cholesterol level to a normal level or acceptable level. But most people, lifestyle modification means, working out every day, exercising, not really every day, at least 3 times a week, and watching what you eat, staying away from trans fat and saturated fat, food that have those things. And it's also good to start reading labels of food and start knowing and staying away from processed food, fried foods, and start eating more natural, healthy food, and start cooking in your home too, knowing what you're actually putting in your pot and what you are putting inside your body is very important, you know, and that will help you to live healthier, live longer. Anyway, where am I? Where are the treatments? What are the available treatments for high cholesterol? There is a medication group that is called statin. There are many of them. Statins. It is one of the most popular medication that is used to treat hyperlipidemia. What they do is that they prevent your body from making cholesterol. Most people tolerate it, and most people are not able to tolerate it. And if you're not able to tolerate the symptoms, meanwhile, before you get started on most of these hyperlipidemia medications that help to treat hyperlipidemia, your doctor will require a baseline liver level, because most of them work in your liver to stop producing cholesterol, to prevent cholesterol. To this time, check your liver panels, your AST and your ALT, to know your level, your baseline level. We call it LFT. To know your baseline level before you start the treatment. Another medication for this for the treatment of high cholesterol is a new one, cholesterol absorption inhibitor. It blocks cholesterol that you have eaten from taking into intestine. Another medication that is used to reduce your cholesterol is called cholesterol absorption inhibitor. They work in combination with statins to reduce your cholesterol level. There is another one that is called nicotinic acid inhibitor. It affects how your liver makes fat. It lowers your LDL and triglyceride, and it raises your HDL. For more information for this video, you can go to Society for Vascular Surgery, National Heart, Lungs, and Blood Institution, American Heart Association, Monitoring of High Cholesterol by CDC, and WebMD. So that is it for now. I hope this helped a lot. Please go ahead and subscribe on my channel and click the thumb up button. And again, my name is Sharon Joshua. I'll be bringing you more of information about prevention, early detection, and treatment availability for diseases and illnesses that you'll be able to do something. Now that you're still healthy and walking around, it is very important you have these information at hand and act on it. It is one thing hearing it, and it's another thing doing something about it. So you all have a blessed year.